Perimenopause is the transition between reproductive age and menopause, which can last several years and affect physical, emotional, mental, and social well-being. With us today is Dr. Brett Gordon, gynecologist and the division chair of women's health at St. Luke's Physician Group. Thanks for joining us today.
Thanks for having me.
Dr. Gordon, perimenopause can look different for each person. Is there an average age range it begins? And what can perimenopause look like?
Well, yeah, it can look different for everybody. Average age, would be in the late 30s, early 40s, going on to the 50s, but really defined, as you mentioned, from the end of their reproductive life to when hormone function really stops. It can have lots of symptoms in various different ways. I think all patients kind of have a different experience.
And I want you to go into some of those symptoms or signs that women can expect with this transition.
Well, sure. The most common one people will talk about is hot flashes, night sweats, sleep disturbance, but it can be a lot of other symptoms as well. Muscle aches and pains, brain fog, menstrual dysfunction, mood changes, difficulty with weight, metabolism.
There can be a lot of focus as well on hormone levels, Dr. Gordon. I want you to talk about that for a moment.
Sure. I think obviously hormone changes are one of the things that highlights this issue in women's life. And so patients very frequently will come to my office, or maybe they've been somewhere else where they've been told that they want to have their hormones checked or make an assessment with regard to that. And my answer to that is we certainly can address that issue, but it doesn't always really highlight what's going on, nor really change the fact that they're going through hormonal changes. The levels themselves are just that, they're levels. And sometimes they'll be normal, but that doesn't mean that they're not having issues with hormone volatility. And so really a focus on treating the patient as a whole is more important than just paying attention to levels.
So glad you framed it that way. What different options, medications, or care can help patients experiencing perimenopause?
Well, I think specifically it depends on what their main issues are. Again, we're interested in treating the person as a whole. If sleep disturbance and hot flashes are their issue, then we'll focus on that, whether that be with hormone treatment or other medications. If their issues are involving pain, for instance, a lot of women going through perimenopause experience nondescript joint and muscle aches and pains. And so sometimes treatment geared towards that, whether it be physical therapy or mood volatility, weight management, screening for insulin resistance and diabetes. Those are all things that kind of tend to change during this part of their life.
What are some common myths surrounding perimenopause and menopause that you would like to clear up?
Well, I think one of them you already highlighted, and that would be hormone levels. I think that one myth is that my hormones, if you check them, they're certainly going to be out of whack, and that needs to be attended to. And what I would say to that is you might have normal hormone levels. And I really emphasize to patients that just because you're told that they're normal or that what you're going through is normal doesn't mean that it isn't really difficult. And so attention needs to be paid to not just checking hormone levels. The other thing is that patients going through this perimenopausal change, that getting hormone supplementation will be the answer to all their problems. We believe in it. We know that it is helpful for most patients. Having said that, as we mentioned before, there's a lot of other health issues and a lot of changes in their body that's going on other than just hormones. And so attending to those needs is important too.
Why is it important for women to continue to see a gynecologist in addition to seeing their primary care physician?
Well, right. It's our niche. Our niche is attending to the needs of women and their life changes. And they don't stop having healthcare needs that are unique to them when they go through menopause. And so we provide an outlet where we can focus on those issues in particular. You don't stop having risk for women's health disease when you go through menopause. And so the importance of still having an annual GYN exam is still a thing. And I think there is a lot of misconception out there that maybe patients shouldn't have to do that, but we certainly advocate for it.
So no matter your age, still go to your annual visit, right?
That you heard it here.
Thank you, Dr. Gordon, for joining us, and thank you for the good work you're doing. We appreciate it.
Glad to be here with you.
To learn more, visit stlukeskc.org/gynecology. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.